Hello friends, this is DRM Dr. Rakesh Mittal, your Surgical Dose. Today we'll talk about a new chapter in urology, that is testes and scrotum. This is a relatively easier topic, and uh, also you get less questions from this topic. Okay, testicular torsion is the most common, then the testicular tumors occasionally, and rarely you'll get questions on other topics like hydrocele and varicocele, etc. Okay, so first is so initially I have kept questions on testicular torsion, right? Different presentations, different types, different options. A 12-year-old boy presented to the emergency with complaints of severe pain in the right scrotum since 4 hours. So young boy, pain in right scrotum, 4 hours. Short duration, young boy. No history of trauma. The most appropriate. This is classical of testicular torsion, right? Inflammatory conditions will not have such a short duration. Plus age, slightly older age, middle age presentation. Like 12 years, young boys, 10 to 25 years, adolescent and young adults, that's the commonest age for the testicular torsion. And short duration, right? Trauma is not necessary, right? Mostly it's because of the anomalies. We'll discuss it in due course of time. So this is a clear-cut case of testicular torsion. Now what we do? Start antibiotics and analgesics? No. Obviously, it's an emergency. It's a surgical emergency, immediate surgery as soon as possible, right? We don't even waste time on investigation. Many people say Doppler is the investigation of choice, but whenever you get this option, we never wait for the Doppler because 6 hours is the window period to salvage to save the testis. So start antibiotic, no. Immediate surgical exploration on right side. When see testicular torsion, you don't know what will be the condition of testis inside. So suppose it's gangrenous and the anatomical malformation that happens on one side, there is a very high likelihood that it might happen on the other side also. So there is chances of testicular torsion on the other side also. So even if the other side is asymptomatic, even if other side testis is completely normal, we always open both sides. Thumb rule, open both sides, and same side you decide according to the vascularity of the testis. If testis is normal, we do orchidopexy. If testis is gangrenous, we do orchidectomy. And other normal side, we do orchidopexy to prevent testicular torsion, because now your patient is left with one testis only. So to prevent torsion on the other side, we do orchidopexy in the same setting. So that's the answer. Immediate exploration on both sides. Okay, that's a quote from the text from the book. I think Love and Bailey. It's a surgical emergency to untwist. See, remember these points also. I found it very useful. How much degree of torsion and the timing. See, twist of more than 720 degree will cause rapid ischemia, then 360 degree or less, right? So untwisted within 6 hours. So 6 hours is the golden period. There is nearly 100% chance of testicular salvage. If you do it beyond 6 hours, it reduces to 20% in the first 20 hours.